Tuberculosis, or TB, is caused by infection with Mycoplasma tuberculosis. This is transmitted by a person with infectious pulmonary TB to another person through coughing, sneezing, or speaking. TB is categorized into pulmonary, extrapulmonary, or both. 10% of these extrapulmonary cases are known as TB arthritis or TB of the joints. The pathophysiology of TB arthritis involves an initial asymptomatic stage prior to the onset of cell-mediated immunity and a variable post-infective stage lasting about 2 to 4 weeks. TB arthritis may either be a disseminated primary infection or latent reactivation of an earlier Mycoplasma infection. Granulomatous inflammation is the hallmark of TB infection. It often occurs in patients with immunocompromised states, and it commonly affects the weight-bearing joints such as the hips and knees, and if left untreated, this disease may eventually lead to joint destruction. TB arthritis is a monoarticular, subacute to chronic inflammatory granulomatous condition. Swelling is progressive and pain develops over months or years. Articular disorders may be characterized by deep pain, limited range of motion, swelling, crepitation, instability, locking, or deformity. Inflammatory disorders may be identified by the 4 cardinal signs. Systemic symptoms such as fatigue, fever, rashes, and weight loss are present in half of the cases. Laboratory evidence of inflammation such as elevated ESR or CRP, thrombocytosis, anemia of chronic disease, or hypoalbuminemia are also found. We can suspect infectious arthritis if the patient is currently at an immunocompromised state, has systemic manifestation, and presents with an inflamed joint. Extracted synovial fluid will be thick with high protein concentrations, variable cell count, and neutrophilia. Acid-fast stains can be used for diagnosis but are sensitive in only 1/3 of cases. Synovial biopsy can be used to confirm etiology and will be sensitive in 90% of cases. However, histopathology remains the gold standard for arthritis secondary to TB infection. Other tests include radiologic studies involving the specific joint region of concern, presenting with peripheral erosions, periarticular osteopenia, and joint space narrowing. For initial treatment of TB, the patient is administered isoniazid, rifampin, pyrazinamide, and ethambutol for 6 to 9 months. Treatment will be prolonged in immunocompromised patients, and the most severe cases will require surgery.